Hello and welcome to Pharmacovania. I am Dr. Shahnaz Malik and we are going to discuss antipsychotic drug part 2. In first part we have already discussed first generation antipsychotic drug, and second part we will discuss antipsychotic drug second generation. Second generation antipsychotic drug are aripiprazole, durazepam, ziprasidone, clozapine, olanzapine, quetiapine and risperidone. These are the atypical antipsychotic drugs. Atypical antipsychotic drugs have weak D2 blocking activity as well as potent 5-HT2 antagonist activity. Extrapyramidal side effects are minimal and they may improve impaired cognitive function in psychotic patients. Clozapine is first atypical antipsychotic drug which block D2 receptor as well as D4 receptor which are present at the basal ganglia, and additional 5-HT2 as well as alpha adrenergic receptors are blocked by clozapine, and fewer or no extrapyramidal side effects are there. Both positive as well as negative symptoms of the schizophrenia are improved and used as a reserve drug in resistance cases of schizophrenia. Clozapine metabolized primarily by CY3A4 enzyme and half-life is 12 hours. The major limitation is higher incidences of agranulocytosis and other blood dyscrasias. Weekly monitoring of the leukocyte count is required, and high dose can induce seizure in non-epileptic patients. Other side effects are like sedation, unstable blood pressure, tachycardia, and urinary retention, and weight gain can occur. Risperidone. It blocks D2, 5-HT2 as well as alpha-1, alpha-2 and H1 receptor, which contribute to efficacy as well as side effect like postural hypotension, and which is more potent on D2 receptor blockade than clozapine, and extrapyramidal side effects are less at the lower doses, less than 6 mg per day, and prolactin level rises during risperidone therapy, but it is less epileptogenic than clozapine, and it should be combined with selective serotonin reuptake inhibitor, and increase risk of stroke in elderly patients, so it should be used cautiously in elderly patients. Olanzapine, it is resembled to clozapine in blocking multiple monoaminergic receptor like dopamine 2, 5-HT2, alpha 1, alpha 2 receptor as well as muscarinic and H1 receptor also blocked by olanzapine. Positive and negative symptoms of schizophrenia appear to be beneficial, and broad spectrum of the efficacy covering schizoaffective disorder, and it is approved for use in mania. Monotherapy with olanzapine may be effective as combination with lithium valproate or benzodiazepine, and which weaker D2 blockade result in few extrapyramidal side effect and a little rise in prolactin level. Incidence of stroke may be increased in elderly, and agranulocytosis has not been reported with olanzapine. It is metabolized by CYP1A2 and glucuronide transferase enzyme, and half-life is 24 to 30 hours. Quetiapine. It is newer short-acting, half-life is 6 hours, atypical antipsychotic, required twice daily dosing. It blocked 5-HT1A, 5-HT2, dopamine 2, alpha 1, alpha 2 and H1 receptor in the brain, but dopamine 2 blocking activity is low, so extrapyramidal side effect and hyperprolactinemia are minimal. Adverse effects are like quite sedating, postural hypotension, urinary retention, weight gain, a rise in blood sugar are infrequent. Uses are benefit negative symptom of schizophrenia, but can be used in mania and bipolar disorder too. It is metabolized mainly by CYP3A4 enzyme, so it can interact with the macrolide, antifungal and anticonvulsant drug too. Other atypical antipsychotic agents are aripiprazole. It is partially agonist at D2 and 5-HT1A receptor, Minimal sedating action may cause insomnia, metabolized by CYP2D6 as well as CYP3A4 enzyme. Adverse effects are like nausea, dyspepsia, constipation, lightheadedness, hyperprolactinemia, hypotension, and QT prolongation are not frequent. Ziprasidone act on D2, 5-D2A and 2C receptor, H1 receptor, alpha 1 receptor blocking activity. Efficacy is in schizophrenia has been related to equivalent to haloperidol. Amisulpride, congener of sulpiride, typical antipsychotic, highly affinity toward D2 receptor and has low affinity toward 5-HT2 receptor, not sedating action. Zotipine is act on the D1, D2 and 5-HT as well as alpha 1 receptor blocking activity. It also inhibits noradrenaline reuptake. Both positive and negative symptoms of schizophrenia appear to be benefit. It has lower seizure threshold and adverse effects like weight gain and hyperglycemia can occur. Adverse events due to antipsychotic drug. CNS adverse effect like drowsiness, lethargy, mental confusion, weight gain, and aggravation of seizure in epileptic. Serious adverse effect like postural hypotension, palpitation, inhibition of ejaculation are due to adrenergic blockade, QT prolongation, and cardiac arrhythmia are risk of overdose of thyroidazine, pimozide, and ziprasidone. Anticholinergic adverse effect like dryness of mouth, blurring of vision, constipation, urinary retention, or hesitation in elderly male patient. Endocrinal adverse effect like hyperprolactinemia due to blockade of D2 receptor is common with typical neuroleptic drug or and risperidone. These can lower growth hormone release but amenorrhea, infertility, galactorrhea, and gynecomastia occur frequently after prolonged use of treatment. Metabolic adverse effect like elevation of blood sugar level and triglyceride level. Extrapyramidal disturbances, it is the dose limiting adverse effect, and it is like bradykinesia, rigidity, and tremor occur. It is occur within the week or months of the initiation of the therapy, and it occur due to the imbalance between the cholinergic transmission and dopaminergic transmission. If the dopaminergic receptor are blocked, then reduce the dopaminergic effect and increase the cholinergic transmission and increase the cholinergic effect. So imbalance between the dopaminergic and cholinergic effect causes extrapyramidal side effect can occur. And tardive kinesia, it is the irreversible and it occur after months or year of the treatment. Other adverse events like hypersensitivity, granulocytosis, cholestatic jaundice, and myocarditis can occur. Miscellaneous like weight gain often occur with the long-term use of the antipsychotic therapy. Blood glucose and lipid profile altered. Risk of worsening of diabetes and blue pigmentation on the exposed part of the skin, and retinal degeneration can occur. Tardive dyskinesia is disorder involved in involuntary movement, especially in lower face like tongue, lip, face, tongue, and extremities. Therapeutic uses of antipsychotic drugs are, first of all, it is the use for the treatment of schizophrenia, prevention of severe nausea and vomiting. Other uses are like the in mania, organic brain syndrome, anxiety. Chlorpromazine is used in treatment of interactable hiccup. Risperidone and haloperidol are also commonly prescribed for the treatment of tic disorder. Risperidone and aripiprazole are now approved for the management of disruptive behavior and irritability in secondary to autism. Thank you for watching the video.